reviewed my orders and made sure I have all my supplies from Miss Ivy Armstrong. She was admitted to the emergency room with some severe stomach issues, and we're going to insert an IV and give her some medication for that. Okay. Hi, Miss Ivy. How are you doing today?
Doing good. How are you doing?
That's good. I'm not too bad. My name's Victoria. I'm going to be your nurse today.
Okay.
Can you verify your name and date of birth for me?
Ivy Armstrong, March 9th, 1964.
Awesome. I'm just going to log in real quick and verify my orders from the doctor.
Okay.
Alright, it looks like we're putting an IV in you today and giving you some medication for that upset stomach you got.
Okay.
How's that sound?
Sounds good.
Alright. Do you have a preference as to which arm I do today?
You can use my right hand.
Your right one? Alright. And is there any reason that I can't perform it on the right hand?
Not really.
No? Okay. Good. Well, I'm going to come over there with you then.
Okay.
So I put that glove on. I'm going to raise your bed.
Okay.
Do you mind if I set my supplies next to you while I do this?
I don't mind.
Awesome. Alright. Already gathered all of my supplies.
Okay.
So when did this stomach pain start?
I started yesterday last night.
Started last night. Yikes. Do you know what could have caused it?
I ate at this new restaurant near my place, so I'm thinking maybe I have a GI bug.
It could be. We've had a few people in with food poisoning, so
Oh no.
hopefully we can get this taken care of.
Oh yeah,
Alright, I'm going to
please.
apply this on your arm so I can get a good feel for your vein.
Okay.
There we go. How's that feel? Is that too tight?
Yeah, that is perfect.
Awesome. Alright, it feels like we got a good vein right here, so I'm just going to go ahead and clean that area real quick.
Okay.
$28, $29, $30. Alright. We're going to let that dry, and while that's drying, I'm going to get my stuff ready, alright?
Okay.
Okay, I got my saline here. I'm going to prime my line.
Okay. My hand feels numb.
Your hand feels numb?
Yes.
Yeah, let me take that off for you real quick.
Okay.
Sorry about that.
You're fine.
Alright, got that. I'm going to go ahead and set this back down.
Okay.
Now the packaging is giving me a hard time, Miss Ivy.
Oh yeah, take your time.
I appreciate that. This ready. Got all that. I'm gonna get me a piece of tape.
Okay.
Alright, I'm gonna have to put that tourniquet back on you, okay?
Okay.
This time I won't leave it on you. How about that?
Yeah, that feels good.
Okay. Is that too tight, or how's that feel?
That feels perfect.
Good? Awesome. Alright, got this piece of tape. Making sure not to touch the spot where I cleaned. Are we ready, Sadie? Alright, yep, I got stuff coming out of there. tea. Apply some pressure up there. Alright, pop that so you're not in pain.
Okay.
Alright, got that twisted on. Use my tape to secure my line. Took me a little bit of trouble to find your vein, but once I finally got it, you were a bleeder, huh?
I'm always a hard stick.
You're always a hard stick.
Yeah.
Gotcha. Alright, I am gonna make sure I got a good line, okay?
Okay.
Alright, yep. I'm getting some flashback there. So I got the right location. I'm just gonna go ahead and pop this lock. Ready? There we go. Alright, now I'm gonna get this ready. It's gonna be a fancy band-aid, alright?
Okay.
Alright, there we go. Then let me get this paper part off for you.
Okay.
There we go. Alright. I'm going to double check that I'm still in the right spot before I do anything further.
Okay.
Yeah, looks like we're still good, okay? Then we're going to remove this piece of tape and we're going to put a fancier piece of tape on there, alright?
Okay.
Since I've locked that, I'm going to go ahead and unscrew this.
Okay.
I'm going to loop it up here next to it. Take that up. Looks all good. And then I'm also going to take this label. There it is. Alright, I'm going to have my name, my initials on it, the time, and the date of birth.
Okay.
Or my initials, the time, and the date. Sorry.
Okay.
That is placed on there. Alright, Miss Ivy, how are we feeling?
Feeling good.
Good? Alright, let me clean up my stuff real quick. And then we'll get you some medication to kind of help with that nausea. How's that sound?
Sounds good.
Awesome. Let me just get rid of this sharp. Alright. Now, I did verify my orders for the medication. Looks like the doctor prescribed you about 20 milligrams of, let's see, a certain medication just to kind of help with that nausea, alright?
Okay.
I believe it's furosemide.
Yes.
Yeah, looks like that's what the orders are for. That's just going to help with your nausea, alright?
Okay.
Alright. So good. I'm going to scrub the top of my medication for 30 seconds. 29:30. A medication syringe. A medication needle. Draw up 2 milliliters of air, because that's how much medication we'll be giving.
Okay.
Inject the air.
Well, we're gonna take a break.
Okay.
I think we're okay.
Okay.
We just keep having
Super convincing stuff over here.
Yeah.
Okay.
We just had a little minor.
Now that I got the medication ready,
Okay.
I'm going to use a second alcohol wipe. Grab another one in here. Alright. And I'm going to wipe off your IV site,
Okay.
your access port here. I'm also going to rub that for about 30 seconds, okay? Just rubbing
Okay.
that real good. I'm going to make sure your access is open. I
Okay.
still have my saline flush here. I'm going to flush your line just to make sure it's still working.
Okay.
Although I just did that a little bit ago, but that way we know your medication gets in there, okay? Alright, now this medication's going right into your IV, alright?
Okay.
Actually, let me get rid of this needle real quick. There we go. And I did my first med check when I got your medication out of the Pyxis. I did my second med check as I was just preparing it. Again, making sure you are who you say you are and I got the right medication for the right person. And then I'm doing my third med check right now as I administer the medication. I'm pushing it slowly. Alright. Now that we got that side, and we're going to flush the line one more time with some more saline, just to make sure all that medication got in her system.
Okay.
Alright, and while I'm flushing that saline, I'm going to go ahead and lock the line again. There we go. Alright, pull that side. And you're all good, Miss Ivy. How we feeling?
Feeling good.
Feeling
Thank
good?
you.
Awesome. I'm just going to throw my needle away. I don't want anybody getting hurt.
Okay.
And is there anything else I could do for you before I leave?
Can you please give me water?
Get you some water? Yeah, I could totally do that. Let me go ahead and lower your bed for you.
Okay.
And you also have your call light within reach. I will be back in about an hour to check on you, but I'll bring you some water before that hour's up, okay?
All right. Thank you.
Alright, your bed is locked. You got your trash can, you got your call light. Be sure not to mess with that IV, okay?
Okay. Thank
Awesome. Let me come around you to grab some hand sanitizer before I leave, alright?
you. Okay.
Awesome. I'll see you shortly.